This week, we're going to be discussing medical terminology, basic word structure. You will find that throughout your healthcare career, that medical terminology will be a part of your everyday vocabulary. So, why is medical terminology so important? Understanding the medical terms will assist you in your future career. Knowing how to correctly pronounce and spell terms will demonstrate professionalism. Misused terms or misunderstood terms could lead to errors. As you will see in the next slide, you will be able to tell by a single word what you're discussing or what you're talking about in reference to the medical field. So let's look at the word hematology. LOGY means the study of. So when you see this at the end of any word, you're going to know that you're studying something. So all medical terms contain suffixes. So hematology, what does it mean? Let's look at the next slide to find out. Heme, H-E-M-A-T, means blood. So now you take the H-E-M-A-T, which is also known as the root word, and you attach it to the suffix. When you put those two together, you already know that ology means the study of, and now you just put together that H-E-M-A-T means blood. So when you put the word together, hematology, it is reference to the study of blood. A combining vowel connects the root word and suffix and can assist in dividing terms into parts. It does not contribute to the meaning. O is the most common combining vowel in the medical terminology. And as you can see there, it shows you how hematology is known as the study of blood. Now, when we begin to combine vowels, drop the combining vowel before a suffix. Remember, suffix is at the end that starts with a vowel. Example, arthritis. Keep the combining vowel between root words. Cerebrovascular. The root plus the combining vowel is called the combining form. Examples, gastro, athro, cardio, cephalo. Let's look at that a little bit further. Some terms may contain two or more root words. Example, gastroenteritis. So when you combine that, you sound it out. Gastroenteritis. Put it together, gastroenteritis. Look at this slide and try to remember these three specific terms. It will help you to be able to distinguish what the word is that you're talking about and how to break it down. Root word gives meaning, can be located in the beginning or the middle of the term. Suffix is at the end of the word. Start defining terms with the suffix. Combining vowels connect the word components. Most often, O is going to be your combining vowel. Now let's look at prefix, meaning at the beginning. Prefix can change the meaning of the word significantly. So first we had gastric, okay? Now we're putting the word sub in there. So subgastric, pertaining to below the stomach. Best way that I can tell you to remember these is to make little analogies in your head. When I look at subgastric, I think of a submarine. It goes below the surface. Transgastric, pertaining to across the stomach, or transverse abdominal, going across. Retrogastric, pertaining to behind the stomach. When we think of different errors, we think of the retro area or the retro years. That means that we're going behind or we're going back. So keep those little tricks to give you a little reminder. Breaking down terms: gastroscope, hematoma, neurologist, leukemia, renal, psychosis, pathologist, nephrectomy. Oftentimes, terms can mean the same thing. Ren or Reno and nephro both mean kidney. One term comes from Latin, ren, and the other from Greek, neph. The Greek root describes the abnormal condition, and the Latin root is used with all meaning pertaining to. Example below: nephritis and renal, both referring to the kidneys. Next, for medical terminology, we're going to look at organization of the body, meaning the body systems. Body systems: cells, basic building block of the body. Examples or types: the muscle, the skin, bone, nerves, etc. Tissues: cells grouped together to form tissues. Types: same as cells. Organs: collections of tissues group working together. We can think of many organs. The example here is stomach. You could think of other examples. Systems are considered as groups of organs working together to perform complex functions. What are some body systems? Here are a few examples of body systems, and they will also continue on the next few slides. Let's look at some of these. The digestive system brings food into the body, breaks it down for absorption, and discards the unusable. Circulatory moves blood throughout the body. Lymphatic carries disease-fighting lymph, white blood cells, or WBC, through the body. Musculoskeletal supports the body and allows it to move. The nervous system carries electrical messages to and from the brain. Respiratory controls breathing and O2, CO2 exchange. Endocrine sends hormones into blood to signal organs and other glands. Skin and sense organs receive messages from the environment and sends to the brain. Urinary filters waste, your urine, from the blood and removes it from the body. Female and male reproductive produce the cells that join to create an embryo. The male testes and female ovaries also make hormones. Body cavities, figure 2.1. Space that contains organs. 5 body cavities: cranial, so we're thinking head area; thoracic, we're thinking chest area; abdominal, we're thinking the stomach area; pelvic, we're thinking down in your private region; and spinal area is to the back or down your spine. Your spinal column is made up of vertebrae, which is considered your bone; disc, which is considered your cartilage between the bone; and the spinal cord itself is made up of nerves. The nerves then are broken down into columns. So as you see here, you will hear people say, I have back issues, I might have a pinched nerve in my lumbar system. This is a great slide that breaks this down for you. Cervical is meaning C1 through C7, 7 bones making up your neck. Thoracic, T1 to T12, 12 bones with connecting ribs. Lumbar, L1 to L5, 5 bones in your lower back. Sacral, S1 to S5, 5 fused bones. And the last one, coccygeal or coccyx, 4 fused bones. The pronunciation of terms. I want you to look over these. If you have any questions, let me know. Try to pronounce them as best as you can. I also find that when you Google how to pronounce a specific term, that Suri or whoever your resource is gives you an excellent pronunciation of the terms and how it is supposed to sound appropriately and professionally. Lastly, we're going to talk about anatomical terms. Bear with me, we're almost done. And we will touch base with anatomical terms in another PowerPoint this week. So if we look at the diagram, anatomical position, this is a patient that's laying on a cath lab table. Always starts with the anatomic position when referencing direction, anatomical terms. There are different planes of the body. As we learned, transverse means across the abdominal or abdomen area. Transverse is axial, superior versus inferior. Superior is above, inferior is below. Then you have the frontal plane, which is anterior to the front versus posterior to the back. You have the midplane, which separates the front and the back portions of the body, as if you were cutting the body in half. Next, we have sagittal, also known as lateral, left to right. Medial versus lateral. The mid-sagittal or median sagittal plane separates the body into equal halves, left and right. So let's look at this slide. Anatomical directional terms. Anterior, meaning in the front or front. Posterior, behind, towards the rear. Distal, away from the origin. Proximal, near, closer to the origin. Superior, above, over. Inferior, below, under. Lateral, towards the side, away from the midline. Medial, towards the midline, away from the side. Dorsal, near the upper surface, towards the back. Ventral, towards the bottom, towards the belly. Take a look at these. If you have any questions or you need any tips, please let me know and I'll be happy to help you.